What are the inherited risk factors for bone cancer? Some people might wonder if their family history could influence their chances of developing bone cancer. While most bone cancers happen due to random changes in DNA, certain inherited factors can increase risk. These inherited risk factors mainly involve specific genetic mutations and hereditary syndromes that make some individuals more prone to developing bone tumors, especially osteosarcoma, which is the most common malignant bone cancer in children and young adults. One major group of inherited risk factors includes hereditary cancer syndromes. For example, Ewing syndrome is caused by mutations in the TP53 gene, which normally helps prevent cancer by controlling cell growth. When this gene is altered, the risk of various cancers, including osteosarcoma, rises significantly. Another example is hereditary retinoblastoma, a condition involving mutations in the RB1 gene. Although this gene is mainly linked to a cancer, people with this mutation are also at higher risk of developing osteosarcoma later in life. Rothman-Thompson syndrome, caused by mutations in the RECL4 gene, also predisposes individuals to osteosarcoma. Similarly, Werner syndrome, linked to mutations in the RECL3 gene, is associated with premature aging and an increased risk of bone cancers. Bloom syndrome, involving mutations in the RECL2 gene, is another inherited condition that raises the chance of developing osteosarcoma. Rare inherited bone marrow failure syndromes like Diamond-Blackfan anemia may also increase the risk of bone cancer. In addition to these syndromes, inherited mutations in genes involved in DNA repair pathways can also play a role. For example, mutations in the SMARCL1 gene have been found in some children with osteosarcoma, suggesting that when DNA repair is impaired, cells are more likely to turn cancerous. Some rare inherited conditions like familial chordoma, caused by mutations in the TBXD gene, can also increase the risk of certain bone tumors. Tuberous sclerosis, caused by mutations in the TSC1 or TSC2 genes, is another inherited disorder that may slightly raise the risk of some bone tumors, although this is uncommon. It's important to remember that while these inherited factors can increase the likelihood of developing bone cancer, most cases are caused by gene mutations that happen during a person's lifetime. Environmental factors like radiation exposure and random DNA errors also contribute to risk. Understanding these inherited risk factors can help with early detection and personalized treatment. If someone has a family history of these syndromes or bone cancers, genetic counseling and testing might be recommended to assess their risk and develop appropriate monitoring plans. In summary, inherited risk factors for bone cancer mainly involve mutations in tumor suppressor genes and DNA repair genes linked to syndromes such as Ewing syndrome, hereditary retinoblastoma, Rothman-Thompson syndrome, Werner syndrome, and Bloom syndrome. These genetic predispositions can significantly increase the chance of developing bone cancers like osteosarcoma. Always consult healthcare professionals for personalized advice, as individual risk can vary widely.